Welcome one and all. On behalf of Acumentis Valencia and DivineMagic Foundation, I, Reena Patil, welcome all our viewers for the second episode of web series on the topic Menopause Awareness, Aging Gracefully. I also welcome Dr. Payal Bhargava, an eminent gynecologist from Hyderabad, who is also co-founder of DivineMagic Foundation. Welcome, ma'am. Friends, we all know that every woman has to encounter the stage of menopause, and this transition affects different women in different ways, with symptoms ranging from mild to debilitating. Today, we are here to discuss how to manage symptoms related to menopause to improve quality of life and thus aging gracefully. Now I hand over session to Payal ma'am.
Thank you, Reena, for your kind introduction. Dear all, today, 18th October 2020 is World Menopause Day, and Indian Menopause Society has completed 25 years. World Menopause Day is held every year on the 18th October. The purpose of this day is to raise awareness of the menopause and the support option available for improving health and well-being. On this occasion, we at DivineMagic Foundation are happy to conduct this public awareness program on menopause. Elderly women are an important part of our society as they have experienced many colors of life as they were aging. Our society is moving towards both men and women going out to work. We need to ensure that the elderly are healthy and happy. We need them to be healthy because there's so much knowledge and experience they have about life. They are a boon for us and their grandchildren. Teaching their grandchildren about religion, culture, stories, home remedies, etc. A woman devotes her entire life for her family. As she grows old, if she is healthy, she can fulfill her dreams, engage in social activities, and lead a happy, contented life. So let's proceed towards our discussion on aging gracefully.
Ma'am, to begin with, want to ask, what is menopause actually?
Menopause is a stage in life when you stop having your monthly menstrual period. It is a normal part of aging and marks the end of your reproductive years. Menopause typically occurs in your late 40s to early 50s.
Ma'am, and why does menopause happen?
Natural menopause happens gradually. As you age, the reproductive cycle begins to slow down and prepares to stop. This cycle has been continuously functioning since puberty. As menopause nears, the ovaries make less of a hormone called estrogen. When this decrease occurs, your menstrual cycle or period starts to change. It can become irregular and then stop. The transition to menopause is called perimenopause. It is typically characterized by shortening of the menstrual cycle, then by skipped cycles. Perimenopause is the first stage in this process and can start 8 to 10 years before menopause. And postmenopause is a stage after menopause. It is very important for all of us to know this because patients usually get scared because of irregular cycles. In our society, a woman wants the periods to either be continuous or stop completely. They are very uncomfortable with this transitional phase of menopause. That is one main reason why they usually go to the doctor to remove their uterus because of the discomfort of irregular bleeding and white discharge. The women who have their uterus and ovaries removed undergo sudden surgical menopause. It is very important to create an awareness that uterus is a very important organ of our body. Even if we remove the uterus and leave the ovaries so that the hormonal changes are not much effective, the ovaries disintegrate after some time. They degenerate. So we are conducting this awareness program to tell people how to age gracefully and peacefully. Some of the symptoms of menopause and its effects are irregular periods, hot flashes, difficulty in falling asleep, putting on weight, losing the muscle mass, bones become weak, the heart is affected, and cancer is common in this age group.
Ma'am, what are the symptoms of perimenopause or menopause?
So the common symptoms of menopause are hot flashes or night sweats, sleep problems, weight gain, loss of libido, hair loss or thinning hair, irregular periods, and mood swings. Other symptoms which you may experience are joint pain or muscle aches, bloating, difficulty concentrating, fatigue, heart palpitations, high blood pressure, itchiness, period pain without a period, bitter metallic taste in mouth, brittle nails, dizziness, nausea, anxiety and panic attacks, depression, digestion issues, headaches, heavy bleeding during your period or no bleeding at all, increased PMS, memory lapses, shorter or lighter periods, bladder infections, urine leaking and urgency, chills, dry mouth or dry eyes, new or worsening allergies. So by these symptoms, the patient feels very uncomfortable and there's a constant feeling of being unwell. So as we proceed in our program, I will let you know that all these symptoms are treatable and you don't have to suffer.
Ma'am, what are the therapeutic lifestyle management one to control the symptoms of menopause?
So today we'll be discussing about the therapeutic lifestyle management of controlling all these symptoms of menopause. So the most important one is physical activity, nutrition, avoid alcohol and tobacco, stress reducing strategies, meditation, massage, pursuing your hobbies, emotional stability, positive attitude towards life, family involvement, spirituality, and a good sleep. Coming to physical fitness, one of the smartest things a woman can do as she transitions to menopause and afterwards is to get regular physical activity. That includes walking, aerobic exercise for her heart, and weight bearing exercise for her bones, both of which may help ward off weight gain and provide a mood boost. Even if a woman hasn't been very active in her younger years, it's never too late to start. Menopause is a new beginning and the perfect time to weave more activity into your life. Coming to the benefits of physical activity and exercise, it helps to maintain a healthy weight, increase in metabolic rate, improves bone density, coordination and balance, muscle strength and joint mobility, improves lipid profiles, reduces heart disease, improves genitourinary problems, relieves depression, induces sleep, and improves quality of life. Now, if you have never ever exercised earlier, it is never too late to start. You can start with simple walking. The recommendations for physical activity and exercise are: exercise should include aerobic muscle strengthening, breathing, and balance. 30 minutes of moderate intensity physical activity, mostly 5 days a week. Muscle strengthening activity should be included at least 2 days per week. 30 minutes per day for fitness and reduced risk of chronic disease. 60 minutes per day for prevention of weight gain, and 60 to 90 minutes per day to avoid regain of weight loss. Now, most of the patients say that they do all of the housework, so they don't need to exercise. No, that is not right. You have to exercise continuously, some physical activity for 30 minutes besides the household work that you do.
Ma'am, now coming to the nutrition, what is the role of balanced nutritious diet in menopause?
So the balanced and nutritious diet should be a diet of a rainbow plate. What does that mean? It means you should have all types of colors on your plate. It is sugar allowed is 6 teaspoons per day, salt 1.5 teaspoon or 3 to 5 grams per day, oil 2 levels teaspoon per day, fruit 100 grams per day, vegetable 300 grams per day, Drink 8 glasses of water every day. Add powdered flaxseed, cinnamon, fenugreek, soft, and salads and curd. A recommendation of diet is snack on 2 to 4 nuts like almonds, walnuts, or dried fruit like dates, figs, apricot, pumpkin, and sunflower seeds. Foods that are rich in phytoestrogens include lentils, kidney beans, and Bengal gram and soy. Avoid more than 200 milligrams per day of caffeine. Limit intake of tea and coffee to 3 cups a day. 1 cup is equal to 150 ml of brewed coffee is equal to 120 milligram of caffeine, 65 milligram for 1 cup of instant coffee and tea. Consume a minimum of 500 to 600 ml of milk or curds, low fat, to build on calcium bank in bones. Support it with lots of vitamin C rich fruits, vegetables to favor calcium absorption. Vitamins are very essential for our diet. In vitamin C, commonly found in broccoli, cabbage, asparagus, and tomatoes. Vitamin E found in asparagus, almonds, lamb, brown rice, and mangoes. Vitamin B, wheat germ, oysters, and liver are all high in vitamin B. Vitamin D deficiency is a pandemic in our country. It is found in soy products, fortified cereals, mushrooms, sunlight, fruits, fortified foods. If you're not going out in sunlight, vitamin D supplement is a must. For the fatty acids, we have omega-3 and omega-6, which is found in flax seeds, walnuts, salmon, and tofu. Coming to the benefits of good diet. Diet in particular is key to relieving menopause symptoms. Studies have shown that a nutritious meal plan with proper hydration and balanced proportions of healthy fats, complex carbohydrates, and lean protein can decrease their severity. Good food options for a menopause diet include, but are not limited to, phytoestrogenic foods like soy, flax, garlic, and parsley. Calcium-rich foods can strengthen women's bone and reduce the risk of developing osteoporosis. Vitamin D-rich foods help with calcium absorption and aid in preventing bone loss and fractures. Vitamin B-rich foods might help in alleviating mood swings and depression. Fiber-rich food can only relieve menopausal digestive problems and prevent weight gain, but also give the heart solid protection.
Ma'am, what is the role of sleep hygiene in controlling menopause symptoms?
A good night's sleep is a must in controlling symptoms because it reduces the effect of other diseases like heart problems, mood swings. So go to bed and get up same time each day. Sleep in a dark, quiet room at a comfortable temperature. Avoid large meals, exercise, caffeine, nicotine, and liquid 2 hours before sleep. Maintain dim light bedroom environment with no gadgets around.
Ma'am, and what about mental and emotional well-being? How does it, controlling both help in also controlling the symptoms of menopause?
Mental and emotional being is very important for the general well-being of a person. Be a learner at all ages, pursue a hobby, continue working, read, bond with family and friends, participate in social activity, enjoy conversation, be happy and contented with your life. It is very important for you to learn something every day and keep yourself busy with positive thoughts and positive work all the time.
Ma'am, how much does the spirituality help in managing menopause symptoms?
So much of spiritual life is self-acceptance, maybe all of it. So performing prayer, meditation, having a positive attitude towards life, and living without expectation will reduce your anxiety. You will have greater self-confidence. You'll have better relationships with your family members and friends. It will help in regaining emotional balance, increased assertiveness. It is stress relieving, and it helps you to cope up with any of your past traumas in your life.
Ma'am, how is weight management related to menopause symptoms?
Now, many women gain an average of 5 pounds after menopause. You also lose muscle mass as you age. Weight gain can raise your risk for high blood pressure, cholesterol, diabetes, heart attack, and stroke. The risk is greater if you're already overweight or not active or eating healthy. The best way to lose weight if you are overweight or obese is to eat fewer calories each day. Exercise or physical activity is also important for good health, but works better to keep weight off than it does to help you lose weight. Eating healthy and getting at least 30 minutes of exercise on most days is the best way to keep a healthy weight. A woman's age-related weight gain occurs around the stomach due to hormonal changes.
Ma'am, genitourinary syndrome of menopause, how do you explain it?
So during menopause, the level of estrogen hormone naturally goes down. As a result, the walls of vagina become thin, dry, and sometimes inflamed. In many women, this leads to symptoms of vaginal burning, irritation, pain, especially during sex, bleeding, or discharge. Some women also have urinary symptoms such as pain when urinating and urinating more often than usual. Together, these symptoms of the genital and urinary tract systems are called genitourinary syndrome of menopause. This syndrome is also sometimes called vaginal atrophy or atrophic vaginitis. Now, patients usually come with repeated history of burning in urine. First time when they get the infection and they go to a doctor, we usually do a complete urine checkup and urine culture sensitivity. So what the patients do, they keep that prescription, and if we have prescribed an antibiotic, they repeatedly go on taking that same drug without going to the doctor whenever they get the symptoms. So this is to be avoided because you may not have any infection and you're going on taking the antibiotic, and when they don't, and when the symptoms are not relieved, they come back. So it leads to a lot of complications. It may lead to stones in kidney and it may affect your kidney also. That is to be avoided.
Ma'am, how is bone health and menopause correlated?
So as we can see in a picture here, as the woman ages, her bones become weak and she starts to bend forward. So we need to protect our bones. Protecting your bones in the 5 to 7 years following menopause, a woman can lose up to 20% of her bone density. So calcium and vitamin D are a must. Menopause and osteoporosis, here we have 5 ways to protect your bones. First is exercise regularly, eat food that promotes bone health, don't smoke, limit alcohol consumption, and consider taking medication.
Ma'am, what is the role of heart health management in menopause?
So heart disease is a top killer of women, and women's risk of heart disease increases dramatically around the time she goes through menopause, typically between ages 50 and 54. A healthy lifestyle goes a long way in preventing heart disease in women. Incorporating the following tips into your everyday life may help you reduce your risk of heart disease during and after menopause. Avoid or quit smoking, as it increases the risk of heart attack. Maintain a healthy body weight. Exercise throughout the week. Eat well. Treat and control medical conditions like diabetes, high cholesterol, high blood pressure, which increase the risk of heart disease.
Ma'am, how important is sex life in menopause and how should it be managed?
Sex life counseling is very important in menopausal women as vaginal atrophy due to deficiency of estrogen leads to dryness, itching, pain, or irritation during menopause. So you have to be active. Physical activity can boost your energy levels, lift your mood, and improve your body image. Stop smoking, avoid drugs and alcohol, have sex more often, allow time to become aroused during sex, practice pelvic floor exercises, avoid products that irritate your vagina. So as we conclude our today's program, The most important thing and the most important message I would like each and every woman who is watching this to know, at whatever stage of your life you're watching this program, start practicing all these things. A healthy lifestyle is the key to happiness in later stages of your life. Stay in touch with your doctor. Don't suffer silently. There is treatment available for all of your symptoms. Get yearly checkup done. Within the 10 years of menopause, we can we have medicines called hormone replacement therapy, which will help you overcome all these symptoms. And you should see a doctor as soon as you have any complaint. Don't treat yourself and don't listen to what your neighbors are telling you to do. Every patient is different and they have different problems which can be managed. So the take-home message of today's webinar is the idea is to die young as late as possible, save the uterus. There is menopause hormonal therapy available and other medicines that will take care of all your symptoms. Please come out and meet your doctor. Take care of yourself, go for a walk, eat your favorite food, get a haircut, cry if you need to. Take care of yourself because at the end of the day, you're all you have got. A smile is the light in your window that tells others that there is caring, sharing person inside. Aging is an extraordinary process where you become the person you always should have been. You are more precious to this world than you will ever know. Thank you for watching.
Thank you so much, ma'am, for such a concise and good insights into management of menopause and how transition towards menopause, if we take charge of our life, becomes easy with the guidelines which you have shared with us today. I'm sure this will be on learning for lots of your patients, and it will definitely help them to overcome the symptoms of menopause. Thank you so much, ma'am.
Thank you, Reena.